You have two disadvantages. Number one is the lack of clinical experience. And number two is your age. Ask Dr. Gray Pre-Med Q&A brought to you by Blueprint MCAT. How are you doing today?
I'm good. How are you?
I'm wonderful. What can I help you with?
So, I had a couple questions regarding, I'm kind of a non-traditional student, but not in the normal sense. I'm kind of younger than most applicants for medical school. I'm applying next cycle, but I graduated high school really early, and I'm graduating college early. So I kind of have an age disadvantage.
Yep.
And it has been hard for me to find clinical opportunities because I'm not 18 yet. So it's hard for me to work in a hospital when I'm not legal enough to work in a hospital,
Yep.
basically. So I was wondering if that's going to put my application at a disadvantage or what I should be doing instead. I have been shadowing a doctor in the emergency room, but I just want to do more hands-on work and I don't know how, I guess.
Yeah. How old are you now?
17. I'm turning 18 in April.
Turning 18 in April, and you want to apply that following month, kind of May, June of that
Yes.
year.
Yes.
And you would start medical school at 19 years old.
Correct.
Ideally, in your
Yes,
in your
ideally.
situation, yeah. So this comes up a lot, either with students graduating high school early, or students who do dual enrollment through high school and graduate potentially high school early. So
Yeah.
they earn a lot of college credits while in high school. They get to college and then they're done in a blink of an eye. And then they go, well, I didn't really have time to get clinical experience because I was just rushing through everything, right? I was just getting
Right.
through everything. And yeah, it does put you at a disadvantage, just like it would put a normal aged, right, typical aged applicant applying to medical school at a disadvantage without clinical experience.
Mhm.
At the end of the day, you're submitting an application saying, I want to be a physician. And if you don't have the experiences to back that up, then all it is just this like theoretical dream that you have, right?
Yeah.
You have shadowing, which is great,
Mhm.
but without clinical experience, and this isn't a hard and fast rule, right? Whenever I say like you need clinical experience, need always has this little asterisk. Could you get into medical school without clinical experience? You could, right? It's possible. It's not probable though. So ideally, what I would do in your situation is to pump the brakes. Which is like, well, that's the opposite of everything I've been doing. Well, let me ask you, why are you going so fast through all of this?
Well, I know it's a long road,
Yep.
and I also know I have had like a lot of health like issues in the past, medical issues that I've struggled with. So I know how like suffering could be. So like the faster that I can help someone, kind of the faster, like that's kind of why I guess like I know how hard it is to suffer. So all I want to do is help someone, I
Yeah.
guess.
Yeah. You're just like, let me start helping. I want to help.
Yeah.
Yeah. So I get it. You have two disadvantages. Number one is the lack of clinical experience. And number two is your age.
Yeah.
Younger students potentially are discriminated against because of your age. So when you think about it, like logically, that person reviewing your application or interviewing you, if you get to that point, is thinking to themselves, they're questioning, can I see you taking care of my loved one? Right? Can I see you at the bedside giving us bad news or whatever it is? Right? Can I see you in that situation? And unfortunately, the perception is that the younger you are, the more immature you are, right? Just that's how we perceive younger people. And
Yeah.
you potentially, in the eyes of the reviewer, lack the just life experience that comes from living and being older. And with that lack of life experience, potentially lacking the ability to empathize with patients going through these situations. Now, you did mention, right, you have your own issues, stuff that you've dealt with, and that potentially negates that, right? You've been through your own medical journey yourself. And so you potentially have that empathy that you can give. So that is just big picture, the potential issues of applying to medical school younger.
Mm-hmm.
What I would recommend doing is delay your application just one cycle, right? Finish school early. That's fine. Do what you need to do. Take the MCAT if you want to take it early. But delay your application one cycle. Number one, to get another year under your belt. And to have the time to get the clinical experience. That's the biggest factor for me, is allowing yourself to get clinical experience so that you can talk about these things in your personal statement, in your activities during your interview. Mm-hmm. It's very hard for you right now to say why you want to be a physician through your experiences interacting with other people. Mm-hmm. It's very easy for you to go, I've been a patient on my own medical journey, therefore I want to be a doctor. That, to me, in my opinion, is not enough. You need that extra, and I've taken care of other people. I've interacted with other people going through their own medical journeys, and that is where my passion lies, taking care of those other people.
Okay.
So, long story short, I would recommend delaying a year just to get some clinical experience under your belt.
And is there not anything that you can do like at the age like under 18 in the clinical sense?
Yeah, it's just going to be a per case basis. You may find a small private practice somewhere that's like, yeah, whatever, we don't care how old you are.
Yeah. And then if I did find that, is like, would that be fine to still apply the cycle, or you still recommend waiting?
I would just recommend waiting, just with your age, with how young you are. So age, and I led with get another year under your belt and the lack of clinical experience. So that's what I would recommend. You can obviously apply. Obviously, I can't stop you from applying. I just know how hard it is to reapply to medical school.
Oh, okay.
Ideally, like theoretically, it's not harder, but ideally, you are coming back with a better application. And so if the majority of your reapplication, assuming you don't get in the first time, is, well, I'm a year older, that's what I've done to improve my application, that doesn't really help, right? Or I have an extra year of this one thing. So just reapplying to medical school, while by itself isn't a bad thing, ideally you're showing improvement through everything. And so it just makes it that much harder to kind of rework your personal statement and your activities and try to be better there and whatever else, right? So it's just a pain in the butt.
Yeah. Okay, I have another question.
Yeah.
So I was planning on applying the cycle, so that's why I'm studying for the MCAT now to take it in January. I actually chose like the first date just because like I didn't know if I had
because you're in a rush.
Yeah. So what is at the point, like, what do you say to yourself? Like, I think I need to retake it, or I think I shouldn't retake it. Like, because I know it's not a pass fail kind of thing. So like, is it based on school? Because I know each school has like, if you need a 511 for your median score, you need this score for median. Like, what do you think?
Yeah. So the language that you just used there is like, you need this score. Almost no school has a specific, like, this is the score you need or else we won't look at you.
Yeah.
Not many schools, if any, have that sort of hard cutoff. So yes, schools have a median score, but that just means half the class is below it and half the class is above it. So it just depends on your application as a whole. How are your grades? How are your activities? How does this look? How does that look? The MCAT is one piece of that puzzle. And the answer is what is your comfort level with applying with a 505? What is your comfort level with applying with a 507, with a 508, with a 510? And at some point you check in with yourself and you go, okay, like you just feel a little bit of relief of like, okay, 512 feels about right for me, right? Yeah. And if I score less than a 512, I won't like that. And I'll reapply. If I score more than a 512, great. That's just cherry on top. And every student has has a different number that they're comfortable with.
Okay. So basically what you're saying is it's preference like per person and it's like
Yeah.
just one part of the application.
It's
It's
just
not.
one part. Yeah, it's a big part,
Yeah.
but it's just one part. You can look at the numbers. The average MCAT score for matriculants into medical school is 511 point something.
Yeah.
Right?
My goal was a 510, so that's right around there,
Yeah.
I guess.
Yeah. It's a good score.
Okay.
Shoot for that.
Yeah.
Shoot for
Yeah.
a 528 and land at a 510. That's great.
Yeah. I'm actually using Blueprint.
There-
I know you guys
There you
partner.
go. There you go. Blueprint's awesome. How are you liking it so far?
It's good. It's really good. I love my tutor and it's helping a lot. The study plan is like amazing and the resources, it's incredible.
Awesome. Good.
Yes.
And how are you doing with your full length exams?
Not bad.
Okay.
Not bad.
Got a ways to
Getting
go.
there. Yes.
It's a
Yes.
process. It's definitely a
Yes.
process. Okay. Awesome. What else can I help you with?
I guess about like just like clinical experience. Like, is there a specific clinical experience that should be favored over another clinical experience? Just any clue.
Yeah, any clinical experience, getting as close to the patient as possible.
Yeah.
Is there any type of clinical experience that you're more interested in?
Yeah. Well, I want to become an EMT. That's kind of like the goal. Because like my goal, long range goal is to be a trauma surgeon. So anything with trauma, like I think that's what I want. And EMT is probably like the closest thing that's not a doctor.
Yeah. Okay. Why trauma surgeon? That's a very interesting pick. Very specific.
Well, I was in the ER a lot when I was like going through all my health issues and like really like made me like fall in love, like want to be like on the other side. And I'm very like fast paced, obviously.
Yeah.
So anything that's like on the spot, go, go, go. I feel like that's trauma. So that's what the goal is.
So emergency medicine, trauma surgery, all that kind of good stuff. Okay.
Yes.
Very cool. Very interesting. All right. So yeah. So if the emergency room, fast paced environment is what you're interested in, go for it.
Okay.
Yeah. See if I'm sure you've looked into it, but potentially taking a course at 17 years old and not becoming an EMT until you're 18. I don't know if you've looked into potentially starting your course now.
Yeah, that was my other question. Like, if I did end up applying this cycle, then could I put on my application, like, I'm training to be an EMT, but I didn't get the licensing yet?
You could. It just won't mean anything.
It won't mean anything. You need the experience.
Yeah. The experience and what you get out of the experience is everything. Not, I got this certification or I'm in the process of getting this certification.
And how long is the cycle? Like, so it starts in May, and then what's like the latest to apply, I guess?
So most schools have deadlines around mid to late October, beginning of November. Most MD, allopathic schools. Osteopathic schools run a little bit later than that, but you can't look at deadlines because medical schools operate on a rolling admissions basis, the majority of them. And so that means as soon as the cycle opens up, they start reviewing applications, they start inviting people for interviews, they start accepting students. And the later that you apply during that cycle, the less opportunities that you have to get an interview, to get an acceptance. Very different than college admissions where you apply, as long as you're in by the deadline, you have the same opportunity and chance that a student who applied at the very beginning.
And it starts May 1st. Is that the beginning of?
So typically there's 3 application services, right? AMCAS, ACOMAS, TMDSAS. They typically open up within days of each other at the beginning of May, roughly. And with ACOMAS, and this has changed recently, with ACOMAS you can basically submit it immediately. Right? As soon as it opens up, you fill it out really quick and submit it when you're ready. With AMCAS, historically, there's been a 1-month delay, and we historically just say June 1st, that's AMCAS submission day. The last couple of years, it's been the end of May. And then with TMDSAS, just last cycle, they put in a pause between when it opens and when you could submit, and it's usually just a couple-week delay, so kind of mid-May that you can
Okay.
submit TMDSAS.
Okay. I think I'm looking at MD program, so
Okay.
MCAT would probably be,
Okay.
yeah. Let's see if I have any other questions. Oh yeah, community service. So that is something to put on your application as well, right?
Everything goes on your application. It's a big mistake. I just had a conversation with a student. He's in his second application cycle. He's several years out of his undergraduate program, and he only had 5 experiences on his application, all healthcare related. I was like, "What were you doing before 2011?" Right? It was 2002 to 2011. He had this huge gap. He's like, "Well, I was working at retail places mostly." Right? Restaurants and retail places. I'm like, why isn't that on your application? He goes, well, it's supposed to be on my application. I'm like, yes, everything goes on your application.
Everything goes on your application. Okay.
Everything, right? With AMCAS, you only have 15 spots. So not everything can go on your application, but everything should go. You should treat everything equally. The application, especially the activity section, is not just a list of here are all the medical things that I've done. It's here are the 15 things, up to 15 things that I consider the most important things that I've accomplished as a person since high school.
And the activity section is completely separate from the personal statement, right?
Correct. Yep.
Yeah, I guess I don't have any more like specific questions. I just wanted to talk about like my disadvantage, like about with my age and everything.
Yeah. Yeah. It'll be there. But it's up to you to help them overcome that obstacle. And clinical experience is going to be the biggest thing in telling your story, with why you want to be a physician, and helping them realize that even at a young age, you understand what you're getting yourself into, and you're ready to go accomplish this dream of going to medical school. So if you need help with a personal statement, we can help you at MAPS. We have some great advisors helping you tell your story. So
Okay.
reach out
Yes,
if you
I
need some help
think
there.
I might. And that just is there like a specific like service for just personal statement or a service for just application?
Yep.
Okay.
All
Okay.
a la carte stuff, or just full application stuff as well.
And to work with you or to work with any MAPD advisor?
So any mapped advisor, I do very little one-on-one stuff these days. So I can
Okay.
come hang out with you for free on Ask Dr. Gray.
Okay. Yeah. That was all my questions. I just wanted to talk about that.
Awesome. Well, good luck.
Thank you.
Happy 18th birthday in the next few months, and
Thank you.
and keep us updated on your progress.
I will. Thank you so much for meeting with me. Have a good night.
You too.